I'm Ed Highland, and this is ASA TV. I'm joined now by Dr. Lee Fleisher, who is the chair for the Committee Brain Health Initiative for ASA. Dr. Fleisher, thank you so much for coming by and joining us.
Thanks, Ed. It's a pleasure to be here, and it's great to be talking about what's happened recently.
We've talked about the Brain Health Initiative over the last 3 years now. Can you give some idea of what strides have been made toward cognitive impairment in patients 65 years and older?
I think the biggest thing is the voice of the patient has come out, that we've been very fortunate. Kaiser Health News picked up what we're doing, had an article that was picked up by multiple newspapers, including the Washington Post, in which Dan Cole talked about his father, Rod Eckenhoff talked about the science. But it actually has caused patients to come forward. I now am on airplanes. I talk to patients and they say, tell me about this cognitive changes that happen after surgery. And in fact, we interviewed a woman named Kathy. Her interview is on the Brain Health website, in which she talks about brain fog, which I think is a term that I've picked up to talk about it. After surgery, that 3 months of not being able to play bridge as well, where her family's noticed she's not quite there. And patients want to know that they get better after 3 months, and she's really helped us hone our way of talking to patients. Irv is also on the website talking about delirium, hallucinations, and partnering, and that's really what we spent a lot of this year doing, partnering with AARP, partnering with the American College of Surgeons, the American Geriatric Society, CMS, through a summit, which hopefully we can talk about soon, has led us to move forward. Now, there's two really important things happening shortly. One is that the 16th, 6 journals are publishing simultaneously a new nomenclature led by Liz Everett and Rod Eckenhoff, the member of our committee, that really talks about a new nomenclature, postoperative delayed neurocognitive recovery. And hopefully that will help lead us by changing and having a clear nomenclature. The other thing is Miles Berger has an article coming out from a summit that ASA Brain Health co-sponsored 3 years ago on best practices, and that should be coming out in anesthesia and analgesia shortly. Finally, the ASA, led by the Brain Health Initiative, is working on an updated best practices, so please stay tuned, because this will really help define, through an expert Delphi method, what are some of the things that you can adopt that would change your practices. So we're very excited about all these initiatives.
You alluded to the value of partnerships. A very important one took place just this year, ASA and AARP getting together in a summit. Tell us a little bit about the summit, some of the things that came out of that.
Well, hopefully people attended the Anesthesia Patient Safety Foundation panel that happened on Saturday at the ASA, in which the AARP representative was there. But we were able to go to their innovation center and really ideate about what patients need. They brought in a lot of patients to give us ideas of how to think about this, and that we had CMS was there, the Joint Commission was there, we had the VA, Carolyn Clancy showed up. And out of that summit has grown several work groups with papers, a strategy to engage AARP in our public-facing campaign. We hope to develop infographics that will be pushed out both for the patient and the provider, but having a public partner like AARP has been fantastic. In fact, after that summit, Dr. Eckenhoff and I were invited by CMS to go and give grand rounds in January, so that all the medical officers for CMS will learn about what we're doing and how we care and are very concerned that our patients hear about how to take care of their cognitive function after surgery. The other key partner has been the American Heart Association. So as we get patients involved in doing healthy living, AARP, American Heart, another publicly facing group, are our partners in saying, you're going to go through surgery soon? Let's get healthy so that you really come out the other side in great shape. One of the outputs of the summit has been a call to action, a set of bullet points of what we believe that the societies, the medical societies, and the public advocacy societies need to do for our patients. And we're now soliciting endorsements from multiple societies. So look out for that call to action.
Dr. Fleisher, how can members actually get involved?
So the exciting thing is that we need ASA members to explain to us what they're doing locally. There is no one approach. And these stories of how they've improved the cognitive function of their patients can be sent to the website. There's actually a portal that we have a writer that the ASA has hired to actually help you describe that story so that you can teach others what you do really well. So again, it's all about the patient. So anything we can do to improve that care by learning from each other is the thing that we hope the ASA members will do.
Give some thoughts, if you will, about the value of research. Over the last couple of years, a lot's been done with the patient. A lot has been done in the way of partnerships and the summit you were just referring to with AARP. But research, we'll call it the unsung hero, if you will, and a lot of that is coming finally to the fore.
Well, that's the exciting thing, and in fact, the American Heart Association asked us, can we be part of these 2 white papers? So one is the state of basic science and what we need to do next. The other is the state of the clinical science, what can we learn, how to take care of patients better. And ASA has been invited by the National Institutes of Health, by, in fact, the National Institute of Aging and the National Heart, Lung, and Blood to come down and talk with their senior leadership about what needs to be done. So it's on everyone's radar screen now, and the real question is, we know some things not to do, we know a few things to do, but it's clear there are gaps, and I hope anesthesiologists, in partnership with our other colleagues in multiple disciplines, can really lead the way and do that research to change patient care.
Dr. Fleisher, thank you so much for joining us.
Thank you.
The Brain Health Initiative, and this is ASA TV.